Monoclonal antibodies. Growth of the abnormal blood vessels is halted, and these vessels begin to break down and regress. Monoclonal antibody drugs are cancer treatments that enlist natural immune system functions to fight cancer. These drugs may be used in combination with other cancer treatments. The effects of monoclonal antibodies on the prevention of blood vessel growth. The population being studied is male and females of ages 20 to 30 and are affected by lung cancer.
The risks and benefits of using monoclonal antibodies are the risks are damage to body cells, potential side effects such as nausea, vomiting, low BP, and heart problems. The antibodies required for the treatment can be difficult to access and can cause rare but serious neurologic disorder. The benefits are that they cut off blood supply that cancerous tumors need for growth. They can also stop the metastasizing of the tumor. The delivery method being used is intravenously. The drugs will be administered with a needle. The cells being targeted are those that create blood vessels, providing nutrients for the cancerous tumor. The cells will be targeted. If the cancer cells are coated with the monoclonal antibody, then they can be targeted by the immune system. The treatment will be released into the targeted tissue or cells by being injected directly into the bloodstream. The treatment, once inside the targeted cells, will block protein cell interactions necessary for the development of new blood vessels.
How will the treatment destroy the cancer cells? The use of the drug bevacizumab or Avastin is administered to the subjects. This drug targets the VEGF, vascular endothelial growth factor. This is to stop blood vessel growth amongst the cancer cell. The trials and objectives. The goals of the trial is to stop and prevent blood vessel growth in the tumor so that it has no supply in order to grow or spread. The hypothesis and the results. The group with the treatment of Avastin should have a smaller size tumor and less blood vessels going to it by the end of the study. Why is the treatment better? Monoclonal antibodies are better for two main reasons. They are cheaper to develop than conventional drugs, and the side effects can be treated and reduced by using mice-human hybrid cells. The trial design.
So the trial design used will be the placebo control. The diagram that we are going with is that the population or the subjects will be divided into two groups, into a group given Avastin and one known as the placebo control group. So the schedule we're going to look at is that after giving them Avastin, we're going to look at them after a 4-week period and expect to see the tumor to stop growing. After 2 months, the tumor will lose size. Okay. Description of the subjects. The subjects must have not taken these drugs: deferriprone, which can lower white blood cell count; panitumumab, which has led to worse treatment outcomes; quadramet, which increases side effects of that affect your bone marrow function; sunitinib, which causes a rare type of anemia; thalidomide, which can increase the risk of blood clots. So these drugs combined with the Avastin may cause gastrointestinal perforation and fistulae. So avoid the use of these drugs in patients who have had ovarian cancer. It may cause fatal fistula formation and permanently discontinue Avastin in patients that have tracheoesophageal fistulae or any grade 4 fistulae. Assessment of safety. So signed and documented consent forms are needed to be signed by the subjects. It needs to be in a controlled and sterile environment. The procedure must be used in order to perform tests. Medical professionals need to be present during trials. There have to be records kept of data, and the subjects have to be updated for every move.